Hello everyone, this is Dr. Nima and this is a quick review for the medical emergencies. This is a handout that you will have on Canvas, and you can study and review for the lab that we're going to do, the simulation lab. Technically, it is not really as graded as an exam. It's more as a practice and to get you to practice the skills. So I'm just going to go through the main medical emergencies, what are the causes, the signs and symptoms, and how we manage them. And we're going to have like a short quiz on that as well. So, one of the main things that can happen, or simple thing that can happen is the hyperventilation of the patient. So the patient is breathing fast. That is caused by stress. It lowers the carbon dioxide in the body, and there's too much oxygen in the body. So the signs and symptoms, there will be a lot of rapid breathing, increased heart rate, lightness, mouth and finger tingling, or lightheadedness. And then the management, we will just give the patient a paper bag to breathe in, or cupped hands, so we can get the carbon dioxide levels back to normal. So bag to breathe in. Syncope or fainting, that's another thing that can happen. It happens because of the lower blood flow to the brain. So sometimes when the patient is sitting for a long time, they just stand upright right after the procedure, they can get that fainting or lightheadedness. They can lose conscious, or they can still, stay be conscious. Anyway, what you can notice is the pale, clammy skin. The management is to place the patient in a supine position or subsupine position, and then also we can give them some spirits of ammonia or something that wake them up, like a distinct smell that can wake them up. Okay. Choking is another thing that can happen. So if a patient swallows something that we're working with, like a crown or maybe like a rubber dam clamp or something, we tried our best for this not to happen. But if it happened, usually, that will obstruct the airway. Definitely the patient will be choking. And, you'll notice them using that universal choking, sign for choking. And you can always ask them, are you choking? And then we can use the Heimlich maneuver, which most probably all of you have done when you did your CPR. So standing behind the patient and with our hands, like wrapping our hands around them and pushing up to get the object out of their mouth. Anaphylactic shock. So everyone can get an allergy, right? An allergic reaction to different things. So for us in the dental office, we have like latex gloves. Some people are allergic to latex or anything like that, or some other dental materials that we might not know of. So there are levels of allergies. So we can just have a small allergic reaction, a little bit of rash, a little bit of swelling, something like that. But the anaphylactic shock is actually the most dangerous type of allergic reaction. So it can be sudden, like it would happen fast within seconds, and then it is life-threatening. So definitely will be rash, swelling. The main thing, the problem is the swelling, so it can lead to obstruction of the airway. So that can lead to choking of the patient. And what we need to do, we need to use an Epipen. So we always have an Epipen. We should always have an Epipen or epinephrine in the dental office. Technically, you open the cap and then you just push it into the thigh of the patient. It can even work through the cloth, and you have to hear it clicks, and you wait for about 10 seconds before you take it out. That's technically the management for anaphylactic shock. But that's what you notice. The patient will just start swelling right away. Their lips and their tongue will swell. And they would actually might have some rash or some red patches on their skin or their face, and we have to act fast to do that. We can always provide oxygen to the patients, and if anything get worse, we can always call 911. But especially with these cases, we do manage them first. angina pectoris, that is a problem that happened. You'll have a lower blood and oxygen to the heart. So like the blood did not get to the muscle of the heart all the way, whether it was a clot or something else. What we will have is the signs and symptoms will be like a chest, pain in the chest area and the neck and the jaw. It will last, about 5 minutes and it'll be relieved. But what we do, if the patients start feeling that, pain in the chest and the neck and the jaw, we have to administrate nitroglycerin. And that is a vasodilator, which means it opens up the blood vessels so it can get to the heart, hopefully, and, relieve the problem. And we put that under the tongue, and we can put up to 3 of these with application. So we would call 911 and administrate oxygen, again, based on the case, loosen tight cloth, and try to sit the patient upright. The heart attack, on the other hand, it's similar, very similar to angina pectoris. The only problem is, or the main difference is that it lasts longer, so it doesn't last 5 minutes, and it's not relieved by nitroglycerin. So if you give nitroglycerin and it was not relieved, so technically you know that now you have to call right away 911, administer oxygen. We can even give chewable aspirin for it. So like this can go to here. Once we get to not being relieved by nitroglycerin, then we have to give chewable aspirin, definitely call 911, give them oxygen, loosen tight the cloth, and get them upright sitting. Stroke, and that happened because of blockage or leaking artery in the brain. So again, blood not getting to the brain. These were to the heart, the angina and the heart attack, and these are to the brain. So symptoms and signs and symptoms: dizziness, confusion, numbness, paralysis, like maybe on one side of the left side of the body or the right side. There will be slurred talking and difficulty speaking, because again, it's hard, something happened in the brain. So all of these things that can happen, the patient can actually lose conscious. We have to administer oxygen, and we have to call the EMS services. Sometimes it will be relieved afterwards. Sometimes it will take longer. So, an asthma attack. So people that have asthma, they might have an asthma attack in the clinic, and a lot of times, definitely, we have to remember we're asking the patient for the history, and that's our first line of defense. We have to be prepared. We have to update the history for the patient, and knowing these things can help us a lot with managing the problems and the emergencies that happen. So, like if the patient have asthma, we always ask, do they have the inhaler with them, because that can help relieve the asthma attack. If they have blood problem, heart problems, do they have have they visit their physician recently, and are they clear to do dental work? So we always ask these questions, make sure that our history is good, and make sure we have our precautions as much as we can. So if there is an asthma attack happen in the office, it will be episodes of breathlessness with wheezing. So the first thing to do is to get the inhaler for the patient, which is bronchodilator, which means it opens up technically the parts of the lungs. And we would give them oxygen and try to calm them down. And if things get worse, we have to call 911. Hyperglycemia and hypoglycemia. Technically, glycemia is sugar. So hyper is more sugar in the blood. Hypo is less sugar in the blood. So this happens if the patient have eaten, especially if they have diabetes and they have eaten but they have not taken their insulin. What happened with hyperglycemia, one of the main distinct or really very important signs are the acetone breath, that the breath of the patient smells like acetone. They will be thirsty, or they have dry mouth. There will be excessive urination, blurred vision, rapid pulse, loss of consciousness, and so on. If the patient is still awake or conscious, they can administrate their own insulin. If not, we have to call 911 and then provide basic life support. Again, if we got a good history of the patient, we know that they might have their insulin with them, or they have taken the insulin after they have eaten. So that's an important thing to know. Same thing with hypoglycemia. That means lower blood sugar. So sometimes, it can happen to any one of us if we haven't sometimes eaten breakfast and, we came in. So there's a lot of insulin, not enough food. So there will be a lot of sweating, dizziness, confusion. Give them sugar, any source of sugar. So we have to always have something sugary like sweets or, some juice in the dental office, just in case for these cases. By just giving that to them, they would, they'll get back to normal. And even if they're unconscious, we can just place something under their tongue or in their mouth a little bit. And usually that will work. We can give injection. Usually the dentist would do that if that's the case, of glucagon, which is technically, a sugary substance to get their blood sugar back to normal. The last two things that we have is the cardiac arrest. Technically, that's when the patient almost dies. So the heart is stopping. It's not pumping anymore. There's no pulse. The heart stopped. The breathing stopped. Loss of consciousness, dilated pupils. We have to call 911 and begin CPR right away. The other thing is the epilepsy. So, as you know, these are seizures. And again, if we have good history, we can know and ask the patient if they have taken their epilepsy medications and when was the last time that they had the epileptic sessions. Anyway, if it happened, we have grand mal and petit mal, and technically petit mal would be like unnoticed. It would be a short amount of time. The grand mal, which is the most common one, that will last longer, 2 to 5 minutes. There will be some body jerks and twitches and stiffness. All of these, they might even lose control of bladder, bowel, or their bowel movement. So we have to understand that once this happens, we have to remove all the sharp objects or anything that we're putting inside the patient mouth or around the patient in the dental chair. So just clear things up, remove any sharp instruments, and let them, go through the seizure. If we have access to, we might be able to put some soft object in the mouth, like a towel or something, but, they can actually cut your finger off as they're twitching or trying to reach through their mouth, and they close their mouth hard. So don't do it if you cannot, it's just if possible. And then afterwards, if they have their epileptic medication, dilating, you can give it to them after the seizure, which is, one of the drugs that they take, for epilepsy generally. As I said, most of these cases, if we take good history for the patient, we will be, we'll be able to manage it. And if we are prepared, we have to always check our dental office emergency kit. So we have to have an emergency kit that has oxygen, has all these drugs that we talked about, an Epipen, a Nitroglycerin, definitely. So different things inside of the dental emergency kit. And we have to know what to do. So usually each part of the dental team would have a specific thing to do. So one of them will call 911, one of them will go bring the emergency kit, one of them would administrate oxygen, and so on and so forth. So always being prepared and doing scenarios would let you learn a lot more about it. Anyway, this is a good handout for you, so you can kind of review it and have it handy. And that's what we'll be doing. We'll give us a scenario on Monday, on the lab day, and we'll have the dummies, and you can notice these things that happen, and you have to manage them in there. So it will be fun.